Right. Hi, everyone. Thanks so much for joining us. Welcome. Appreciate you being here to join our funder dialogue on building the movement for perinatal mental health and justice in California. We are recording this webinar, and as you get settled in, please drop in the chat your name, your organization, and what brings you to this conversation today. We're going to give everyone a few more minutes to join, so please introduce yourselves in the chat as you do that. And in the meantime, we will share a short video from our Alliance's Pain to Power LA convening. This event took place almost exactly a year ago during National Mental Illness Awareness Week, and it helped launch this movement.
I would like to welcome you all to our From Pain to Power, a postpartum mental health convening on storytelling and policy change. And we are so excited to see your faces today. We've created this space today to uplift the voices of those impacted by mental health challenges during pregnancy and the postpartum period.
Your presence reflects a powerful shared commitment to addressing the perinatal mental health crisis that's impacting families here in LA and beyond. Today marks a pivotal moment in the movement for perinatal mental health justice. Through education, storytelling, and advocacy, we are moving from pain to power.
There's a lot more that can be done, and keeping this intersectional approach will help not only strengthen the policies that we enact, but frankly, the lives that are supposed to benefit from them.
We're counting on you to join in this movement because women together can do anything.
Each one of you in this room, no matter who you are a change agent.
Yes.
You are a champion. You are an advocate.
Let's partner with each other, with our community, with policymakers, with strangers, to reconnect to the love and the power.
Now more than ever, we must come together to break the silence and advocate for long-term systemic change.
Right. I hope that gets you a little bit fired up and excited for the conversation ahead. And thanks to those of you who have introduced yourselves in the chat. If you haven't had a chance to, please feel free to share your name, your organization, and what brings you to this conversation today. My name is Somo Suparakchinda. I'm a social impact strategy consultant focused on the maternal mental health and motherhood space. I'm also a postpartum depression and anxiety survivor and have been consulting with CPWA since joining the coalition's Advocacy Day just this past spring in Sacramento. Today, we are really eager to share the story of how our survivor-led movement has grown in California. Our goal is to introduce you to our coalition partners, highlight the progress we've made together, including the momentum we've had with SB 626, as well as the opportunities ahead to build a coordinated, equitable perinatal mental health system. We are inviting you into this journey as partners. We've allocated time at the end for discussion, but please feel free to enter your questions and feedback in the chat throughout, and we will do our best to monitor and respond. Now, I'm excited to introduce CPWA's founding director, Cassie Gardner-Manjikian. She's a postpartum psychosis survivor, nonprofit social justice consultant, and coach, and she brings 2 decades of community organizing and movement building experience to this work. Cassie, over to you.
Thank you so much, Somo, and hello, everyone. Thank you for being here and making time to join us today. I'm Cassie Gardner-Manjikian, co-founder and director of the California Perinatal Wellness Alliance, or CPWA for short. This movement is deeply personal for many of us, and to start, I'd like to share my own story and how CPWA came to be. As a reminder, if our stories today feel heavy, please care for yourself however you need. 9 years ago, I had what most would consider a perfect pregnancy. I had private insurance, a public health degree from UCLA, and I'm white. I took a short depression screening and felt fine, but there was no assessment of my history of anxiety, depression, or family members with bipolar disorder, all risk factors for postpartum psychosis, a condition I'd never heard of. After a long labor, I went home within hours and couldn't sleep for 5 days. The hallucinations and intrusive thoughts felt like being trapped in hell. At the ER, even though the hospital had a maternal mental health program, my care was siloed and traumatic. I was transferred to a psych ward where I was shoved in a padded room, bound in leather restraints, and sedated. My recovery took 7 years, cost over $30,000 out of pocket, and nearly cost me my life. And I'm one of the lucky ones. Black women are more than 4 times more likely to die from pregnancy-related causes and face far greater barriers to care. 2 years ago, I began sharing my story publicly, thank you for the hearts, through filmmaker Dev Herbert's documentary, The Imperfect Mothers Club. I joined the board of Maternal Mental Health Now, amplifying my voice in the news and at events where we saw how storytelling is medicine. Last October, almost a year ago from tomorrow, alongside 5 organizations, we co-hosted the From Pain to Power convening in South LA. We brought together 200 survivors, providers, and policymakers to reimagine what a just perinatal mental health system could look like. That's how the California Perinatal Wellness Alliance was born. Together, we co-created SB 626 to strengthen screening and care coordination and to shift California's language from maternal to perinatal, reflecting diverse birthing experiences, which you'll hear more about later. This past April, we organized an advocacy day at the Capitol, bringing 25 survivors among 40 advocates to meet with 51 legislative offices. The next day, SB 626 passed through the Senate Health Committee unanimously. And one of the most powerful moments was when Republican Senator Valladares shared her own postpartum story publicly for the first time and joined us as a co-author, proving how storytelling changes policy. And the need for change is urgent. Perinatal mental health conditions are the most common complication of pregnancy and the leading cause of maternal mortality in the US. 1 in 5 mothers and 1 in 10 fathers experience these challenges, yet only 15% receive treatment. Untreated, these conditions lead to higher suicide rates, poor birth outcomes, long-term developmental delays in children, and cost California $2.4 billion annually, hitting marginalized communities hardest. Families fall through the cracks due to stigma, little public awareness, limited provider training, and lack of follow-up care. And these aren't individual failures, it's a preventable public health crisis hidden in plain sight. And right now, California is at a pivotal moment. SB 626 passed every policy committee unanimously, but was held to next year due to resistance from multiple state agencies, even though we all share the same goals. New state initiatives like the Birth and Care Pathway, Maternal Health Blueprint, and Proposition 1 all aim to transform maternal health, but they'll only succeed if communities most impacted are at the table to guide implementation. This is our moment to align policy, funding, and systems change. And that's where CPWA comes in. We're a survivor and community-led statewide alliance of more than 20 partner organizations and 600 advocates advancing policy and systems change, storytelling and narrative shift, and movement building. We don't provide direct services, we build connective tissue among stakeholders to ensure no parent falls through the cracks. Because when families thrive, communities thrive. And all that you've heard, we've built as volunteers with donated time and lived experience. We're fiscally sponsored by the social and environmental entrepreneurs, thanks for being here, and have received event sponsorships, but no core funding. This week, we released a storybook shown here with 30 survivor stories published statewide, and we're winning. But what we need now is partnership with values-aligned funders willing to co-create this movement with us, and that's why we're here today. Together, we can make California a model for transforming the perinatal mental health system rooted in healing and justice. And with that, I'm honored to turn it to our survivor storytellers who are at the heart of this movement. Please welcome Diamond Lee, the visionary behind the motherboard.
Hi, everyone. I'm really grateful and happy to be here. And thank you, Cassie, and the whole Alliance team for your leadership in championing this bill. My name is Diamond Lee. As mentioned, I am the visionary and co-founder of the Motherboard, which at this point is a collaborative of 21 moms that we're hoping to grow based in LA County. And I'm not going to share too much. I just want to introduce because I think it's better to hear from the Mother Board members themselves. They will speak for themselves and the work of the Mother Board in terms of what the Mother Board is, as well as who, what their participation has been in this journey with the California Perinatal Wellness Alliance. So I'm going to introduce the three of them that are here, and then they will speak to their experiences. So first I want to introduce Jade, who is in the storybook. So you can learn more about her and her journey in the storybook. Jade is the co-lead or one of the co-chairs of the Abundant Birth Healthy Start Subcommittee of the Mother Board. A phenomenal event planner, mother of two young ones, both, well, one is 5, maybe he just turned 6, and a 3-month-old. And she was pregnant at the time we were in Sacramento advocating. So she will speak to what the Mother Board is and providing an overview. After her, Yvonne will share, who is also in the storybook, who also was in Sacramento, and she will kind of share her experience as a survivor of perinatal mental health. And she is the mother of a little one too, MJ, who is very magical and phenomenal. And then finally, Felicia will share. She and her little one were both in Sacramento as well. And she is a staunch advocate in terms of anything that needs to happen within the Mother Board. And she can really speak to her experience in Sacramento and what it meant to be there, advocating for an issue that deeply impacts folks with maternal mental health conditions. So without further ado, I'll pass it over to Jade.
Hi, can you guys hear me? Okay, great. So what's Motherboard? You're probably wondering. Well, I'm here to tell you. Motherboard is really a beautiful response to the Black maternal health crisis. It's an advisory board that's led by Black moms with lived experience. We come from all different walks of life. And really, we are combine our forces to be a bridge of lived experience to systems that are making change so that we don't, we're not just being heard, but we're actually like having a seat at the table, and we can help form these policies and we can help make the decisions that we're being impacted by, right? Motherboard's also a really good opportunity for organizations and agencies to be able to collaborate with community. So it's a great opportunity to connect directly with Black moms and families and receive real-time feedback and insight on shaping policies, programs, and just getting grounded in being really effective. The last thing I want to say about the Motherboard is that it's really just a community. To me, it's the best part about it. It's just a space where Black moms are able to really connect and build and bring our ideas and our power together. And just in terms of creating support for each other and just reimagining something different. So thank you.
I'll pass it to you, Yvonne.
All righty. Hello, everyone. My name is Yvonne, and I'm a proud mother of 2. My oldest is 24 years old, and my youngest is just 2. Becoming a mother of 2 were very different stages of my life, has been both a blessing and also a challenge. When I had my daughter in my early 20s, I was trying to still figure out some things. I was basically teaching myself how to be a mother and just my purpose, and still was in college at that time in my 20s. Now raising my son in my 40s, I'm navigating motherhood again, this time with more wisdom, but also with a different purpose. Because when I found out I was pregnant, I was dealing with fibroids, and they kept telling me the miscarriages and everything kept happening. And it was just a burden. I was just like, I'm not going to be able to carry this baby. But just balancing health, work, and the emotional demands of starting over when people assume you already know it all. That one moment that stands out in the prenatal mental health journey was feeling invisible during my pregnancy at 41. Doctors were quick to label me high risk as I walked through the door because of my age, gestational diabetes. I had to take tests to make sure, if your child is going to have disability or not. So I was began to be labeled before anything. My needs, my fears, or the support I truly needed as a Black mother, I often wish they had been more cultural compliment and compassionate care and spaces to open it up, share my struggles without my judgment. That's why participating in the Pain to Power storytelling campaign means so much to me. It gave me a place to turn my challenges into advocacy, to remind other mothers that they are not alone and push for better systems of care so that moms like me, whether younger or old, can be seen, heard, and supported through every stages of motherhood. Age is just a number, but motherhood is the greatest gift ever. So I'm here to say that I appreciate being a part of this campaign and being also a part of motherhood and the mother board. Thank you.
Thank you, Yvonne. And last but not least, Felicia.
Hello, everybody. My name is Felicia Berkeley. I am a mother of one baby girl who's 2 years old. And the impact that going to Sacramento had on me as a woman, as a mother, as a child, a daughter, was monumental. It really showed me the power of connection and collaboration. Just seeing Casey and everybody who was involved, Devora and her documentary, and where it started and where it was growing was so inspiring to my spirit. It ignited something that I didn't even know was there. Politics has never been my forte, something I was not interested in, but this showed me that we can have impact. Something that's important to you needs to be heard. Women are so vital, so integral in our communities and in our societal structures. And so just being there was so inspiring in so many areas of my life that it really, really helped me see that we can do this and that it's about bringing other people on from different walks of life, from different areas, and allowing them to use their gifts and their skill set to build something. And so it was wonderful. And so that is why I'm here, and I will continue to want to see this go far. So thank you for having me.
Amazing. Thank you so much, Felicia, Yvonne, Jade, and Diamond. We so appreciate each of you and your powerful stories and reflections. Now we'll hear from 3 of CPWA's core partners here in California who are connecting these lived experiences to statewide policy and systems change. Our 4th core partner, the Policy Center for Maternal Mental Health, couldn't join today, but brings a vital national perspective to our advocacy efforts. Panelists, please introduce yourselves by sharing your name, role, and a minute about your organization in the order you're listed on the screen. Please, Kim, please start us off.
Hi, good afternoon, everyone. It's a pleasure to be here with you all. My name is Kimberly Gray, and my pronouns are she, her. I'm currently the Director of Perinatal Mental Health Equity at Maternal Mental Health Now. We are a Los Angeles-based organization dedicated to ensuring that every person and family receives the care and mental health support they need throughout their perinatal period. We work alongside healthcare providers, clinicians, and birth workers, equipping them with the tools, training, and compassion needed to respond equitably to families in their care. I also have the distinctive honor of leading our Black birth workers community, which is a space that centers joy, connection, and the wisdom of those who are walking closest with our families. Through their voices, we learn that care should be rooted in trust, culture, and in community. And as someone who has personally experienced pregnancy loss, this work is deeply personal to me. At Maternal Mental Health Now, organizationally, we see perinatal mental health as living right at the intersection of policy, practice, and community. So it's my great honor to have the opportunity to be here as part of today's conversation. And I will turn it over to Elise.
Hi, everyone. I'm Elise Springer. I'm a licensed marriage and family therapist and certified in perinatal mental health. Actually came to this work through my own postpartum experience 16 years ago and turned my pain to power, although I did not have that amazing phrase at the time. So I turned my own pain to power with stints as a board member and training faculty for 2020 Mom, Maternal Mental Health Now, Return to Zero Hope, and Love Dad, which is a paternal perinatal nonprofit. I'm currently a founding member and board member for the California chapter of Postpartum Support International, which, PSI offers a free confidential helpline in English and Spanish, tech support, and online support groups for birthing people, partners, and families. We also provide professional training and the certification and a provider directory to connect families to qualified care and advocacy. And in the state of California, much of our policy work the last 2 years has been on AB 2581, which did get chaptered in 2024, requiring licensing boards to require perinatal mental health education. Currently, no therapists are trained before licensure and grad school, before they go to CPS. This November, we're going to have the opportunity to speak directly to those licensing boards. So I am going to turn it over to Lakeisha.
Thank you so much, Elise. Lakeisha Kamish, she, her pronouns, Interim Policy Director for Black Women for Wellness, Black Women for Wellness Action Project. We have a C3 and a C4. Black Women for Wellness has been around for roughly 3 decades and servicing the Southern Los Angeles area, particularly Leimert Park. The Action Project, which is a co-sponsor on SB 626, came about around 2017. We were in the in the first regime of this fascist movement. And we realized that we need to further invest in advocacy efforts to protect and expand reproductive rights and justice for Black women. We are all about the health and well-being of Black women and girls. And we realized that we have to advance the right policies and also elect the right leaders. So we do a lot of work not only in the political space, legislation, but we also do work in endorsing candidates, not just in the state level, but also federal, local, all the way down to Superior Court judges. So our work expands the whole range of RJ, and that is whether it's beauty products, whether it's safer products for our women and babies, if it's advancing environmental protections, because one of the pillars of reproductive justice is to raise children in safe and sustainable neighborhoods. It's rooting out that bias that is deeply rooted in racism and employment and healthcare and housing. But we are consistently advocating for the health and rights of Black birthing people and families across California.
Thank you so much, Lakeisha. Incredible to hear about all your work. And now we're going to hear a little bit more from each person. And together we'll sort of offer a global perspective of the problems, solutions, and impacts of this movement. So we'll start with Kim and the on-the-ground challenges that make this work so urgent. Kim, Maternal Mental Health Now has been leading this work in LA for over 18 years. Can you share a story from your community that illustrates the scale and human impact of perinatal mental health and justice challenges? And what are the most pressing challenges families are facing right now, which makes sort of why systemic reform is so needed?
Yeah, thank you for that question, Cassie. At Maternal Mental Health Now, we've seen how critical both continuity of care and a trained workforce is, especially for families who experience some of the biggest disruptions once they leave the hospital. Too often, as we've already shared with some of the data statistics, especially for Black and Brown families, care stops right when it's needed most. The baby may be home, but the parent is still recovering physically, emotionally, and spiritually. And the systems that should hold them often let go. And those gaps in care aren't small. We've seen stories time and time again where if care is not continuous, it could potentially be life-threatening. And that's where funders and policy advocates make the biggest difference. Is why we're here today. And maybe by helping ensure care doesn't end at discharge, but continues in community. Some of the data that you shared earlier, we reinforce it. Nationally, suicide and overdose account for about 20% of postpartum deaths. And 1 in 5 birthing people experiences a mental health condition. And even more than that, nearly 2/3 of perinatal suicides happen after the traditional 6 weeks postpartum window, when medical care often stops or tapers off. And here in Los Angeles County, Black women are 4 times more likely than women of other racial or ethnic groups to die from pregnancy or postpartum complications. They're also twice as likely to experience a perinatal mental health condition, but half as likely to receive care. These aren't just disparities, really, they're the direct result of systems designed without continuity in mind. So I think about one of our programs here at Maternal Mental Health Now, our Strength in Tiny Steps, which is a circle for Black families with infants in the NICU. Parents in that group have had to navigate fear, medical uncertainty, and exhaustion, often with no follow-up mental health plan. Through Strength in Tiny Steps, they found a space to breathe, share resources, and reclaim community care as medicine. And that ripple effect has been powerful. We oftentimes see this within our Black birth workers community, how lived experience often shapes your purpose and how you become an advocate. We just heard from the motherboard as a direct example of that. So 2 parents from our Strength in Tiny Steps NICU circle have gone on to become doulas. So now they're supporting other families in crisis. And for us, that's an example of what happens when care continues, healing multiplies, and the workforce grows. People reflect the communities that they serve. And so the disparities that we see are not inevitable, they're systemic, and systems can change. We see the same barriers across our perinatal populations. Queer and trans parents are navigating unsafe systems. Immigrant families are facing care interruptions, and parents of color are carrying both the weight of isolation and stigma. That's why our call to action is pretty clear. Funding continuity of care and community-based resources like peer support and the birth workforce pipelines. This is where we meet at the intersection of policy and advocacy work that will sustain what's happening within our communities. When care follows families throughout their journey and when it's delivered by people who understand their experience, we don't just improve outcomes, it allows us an opportunity to transform systems. And quite honestly, that's where the real impact lives.
Amazing. Thank you so much, Kim. And I can just share as a board member for Maternal Mental Health Now, I've seen how all of these transformative changes at the local level really do have transformed into state level change here that we're trying to make. So thank you, Kim, for grounding us in those local to global connections. So building on that, let's turn to Elise and how we connect these local stories and needs into a coordinated statewide response. Elise, after nearly 2 decades of work in this field, you know how fragmented it's been, from early task forces to hotlines and peer groups that still leave many families behind. Why do you think a coalition approach like CPWA is so critical right now? And what makes the survivor and community-led infrastructure uniquely positioned to align organizations, providers, and decision makers across California?
Thank you, Cassie. So, the passage of ACR 105 in 2010 was sort of the first piece, right? It designated May as Perinatal Mental Health Awareness Month. And the goal is that stakeholders could come together to improve access for new parents. And many of the organizations, Maternal Mental Health Now, PSI, and other local groups have stepped up. But the truth is, I think the work has really been fragmented because the scope of the problem is just so big. California sees 420,000 births every year. That's over 800,000 new parents. So then when you think about the statistics that we've seen and heard already, 1 in 10 dads, 1 in 5 birthing parents, those numbers actually don't even include miscarriage, termination, stillbirth, or adoption. So it really is just too vast in California for any one organization or initiative to hold alone. We've all been doing our best with limited capacity, many of us volunteers, but the needs are bigger than any single program, grant, organization, or campaign has been able to meet piecemeal. So look, we have some safety nets like peer groups and warm lines, and advocacy has definitely moved the needle, particularly in California. And these help some families survive a crisis, but that's when they actually know that there's a crisis and when their providers understand that there's a crisis. Prevention, education, and early identification are really where we're falling short. And as a movement, I think, frankly, there were some missteps that were made along the way inadvertently. And for example, in 2010, the ACR was perinatal, and the new ACR in 2014 switched the focus to maternal. And that is what left many of the folks out of the work that we've been doing, like partners and families who've had miscarriages and loss and are no longer considered mothers or maternal and then not screened and so on. So the perinatal period is just so much more than the medical window. It's a full system experience. Stigma, racism, housing instability, financial pressure, birth trauma, fertility challenges. Our systems haven't really accounted for that complexity, so families have slipped through the cracks, and I think that's despite everyone's best intentions. I think that's why a coalition approach really feels necessary right now. Not necessarily because we need another new organization, but because we do need stronger connections between the ones already doing this work. Like a coalition like CPWA isn't about replacing any existing network. It's really about weaving them all together and creating that infrastructure that lets the survivor voices, that lets the community leaders and providers and policy makers really sit all at the same table and align around shared goals and learn from one another. And I think that has been the case with SB 626. So what makes this moment unique is that this coalition is particularly survivor-led and community-led. It's grounded in lived experience, not just policy language. And I think that's what really gives it that credibility and reach. It's exciting because it recognizes the strengths that already exist, like PSI's Warm Line or Maternal Mental Health Now, Sana Sana, or Black Women for Wellness, like amazing groups. Everyone's doing this powerful grassroots work, but SIPWA help connects those dots. So what's happening in these pockets of brilliance can start to inform the whole systems at scale. And seeing SIPWA as a container for shared learning and shared data and shared advocacy, I think that's what helps make the collaboration easier. And then, when families reach for the support, they find a coordinated effort rather than the isolated programs. So, when I think about why this is so critical now, we've spent at least 15 years since 2010, that ACR, building pieces of a solution. And I just really love the idea of bringing these pieces together, not in a competition, but in a community. So I hope that answered, because I got a really dense question. So hopefully that answered, and speaks to the passion that I think we all have here too, to kind of build it as a coalition.
Absolutely. Thank you so much, Elise. Yeah, just really, we have so much expertise in this space, and to watch, all the partners bring the lived experience, the advocacy, the clinical expertise, and then really seeing CPWA, you spoke so well to our role and approach in providing that network infrastructure to really maximize everyone's contributions and really raise all ships in doing so. So thank you so much, Elise. And that brings us to the impact and what it looks like to build real power on the ground. We heard from Lakeisha with Black Women for Wellness, and they've really been the muscle in our alliance, grounded in community organizing, trusted relationships, and bold policy advocacy. Lakeisha, in today's political climate, what does building power look like in your community? And why is it so essential to center mothers and birthing people in that fight?
Thank you so much, Cassie, for that. This current political climate, it's not the prettiest situation to be in, I will tell you that. But for us, for building power, especially in South Los Angeles and Leimert Park, for Black birthing people, it looks like ownership. It's our stories, it's our policies, it's our solutions. So it means that we are making sure that those that are directly impacted by those inequities in healthcare and housing and economic stability, they're not just included in the conversation, but they are leading it. From the perspective of Black Women for Wellness Action Project, building power has always been about transforming and taking us from that advocacy position to action, ensuring that our lived experiences are shaping that legislation, any budget allocations, and all systems of care. What we've seen that happens when Black birthing people are left out of that policy making piece, the data tells that story of crisis. It shows that that lived reality is now a story of neglect. So, we know that the numbers are not good, especially when we did the data polling for SB 626 in South LA, that families are continuing to see those higher rates of maternal mortality and limited access to that quality perinatal care, and just barriers to reproductive autonomy as a whole. In this moment, especially with reproductive rights being under nationwide attack and just widespread economic inequities, centering mothers and birthing people is no longer optional. It's essential. We've learned that when Black birthing people thrive, whole communities thrive. Our collective health and education outcomes and our generational stability, they all begin with safe, supported births and the right to make those decisions about our own bodies, and also to have those support systems in place. With Black Women for Wellness Action Project, our advocacy reflects that truth. We fought to advance many policies that expand doula access throughout Medi-Cal, that we hold hospitals accountable for that racial bias in maternal care, and that we invest in community-based reproductive health programs rooted right here in that community that we serve. We advocate for those policies that protect abortion access and improve maternal mental health, and just make sure that we are looking for those Black-led solutions across the perinatal spectrum. So, to me, building power means that we use every tool available. That's community organizing, that's our legislative advocacy, civic engagement, voter mobilization, coalition partnerships, to make sure that we are having our voices heard, not just on the block, but all the way up to the Capitol. And it's not just about changing those laws, it's about changing culture, shifting who gets to define what health and safety and care look like for Black birthing people and families. And I keep thinking that forward motion of when we look ahead, we have to build power by investing in, that leadership development for our young people that are coming after us. Right now, they have less reproductive rights than we had just a few years ago, and that we continue to uplift the work in our community of our birth workers, and just continue to show up. And I mean, show up everywhere, hearing rooms, rallies, at the Capitol, in coalition with others. And, to make sure that our birthing people have the resources, the respect, and the representation that we deserve. So, that building power looks like for us, it's a movement that's rooted in love, that's grounded in justice, and determined to deliver liberation through policy change and collective action.
Wow. Thank you so much, Lakeisha, and to all our panelists for the incredible work and wisdom you've shared. Just hearing about the survivor-led strategies, changes in policy, culture, and impact rooted in love and justice. That is really what we need in today's divisive culture and political landscape, right? And as we said, moms leading movements and birthing people leading movements, that's really what's needed in this moment for impact, right? So thank you so much. We are going to move on in the interest of time, since this is a funder dialogue, to really look at how funders can play a role. And I would like to ask our panelists, just to close your section, maybe to pop out in the chat, put in the chat in one sentence, if funders in this room could do one thing differently to better support perinatal mental health and justice organizing, what would it be? So I'll pop that question in the chat and would love to hear our panelists' reflections. And I'll just share my own reflections verbally. I really want to deeply thank the funders who are investing in this work. And if I could ask one thing of funders, it would be to fund the ecosystem, not just individual organizations, and invest in the infrastructure, relationships, and coordination that allow coalitions like ours to sustain momentum, speak with a unified voice, and keep this movement strong long after any one project ends. And that's what our next speaker embodies. So to reflect on what it means to seed and sustain this work, I want to turn back to Diamond with the LA Motherboard, whose leadership and stories really are at the heart of this movement. I'm really proud that they provided CPWA with our first grant, allowing 11 Motherboard members to travel to Sacramento, share their stories, and grow as leaders. So Diamond, over to you.
Yeah, what an honor it was. When I found out we were the first, I was like, what? How could this be so? And I'll just say, when Black Women for Wellness, and specifically Gabrielle Brown, who I know is on this call, big shout out to Gabby for her, vision to strategically kind of reach out and partner, reached out and talked about this survivor-led coalition and the work of SB 626 and the work of CPWA. It was like the potential for us to kind of provide a grant for the motherboard to attend the Advocacy Day in Sacramento. It was a no-brainer. And I will say we get public and private funding. We did use public dollars for this. And so we were able to be creative in how we funded this so that moms could go, because one would think, oh, it's advocacy. How can you Well, it's actually capacity building, right? You see all that the motherboard was able to share in terms of what they learned and being able to go and speak with legislators. And we did our own evaluation of, the impact this day had on them. And it was being able to learn about, what makes a bill a law, being able to know what it takes to be able to speak to, legislators, being able to just understand legislators are people, right? They're human, their staffers are human. So this is much further beyond just advocating for a bill. This is, as what's been lifted up time and time again on this call, investing in the leadership of folks with lived experience, investing in coalition, right? And so it's like, what can I do? Invest. Don't find excuses for why you can't do it. Get creative about how you can, right? Because there are ways to do it, even in the climate that we are in. There are ways to make sure that we are investing in policy and leadership, and programs that are effective. And so, as has been lifted up, CPWA has absolutely demonstrated their ability to collaborate across the state, but also to center the voices of those that are most impacted in everything that they're doing. And so, couldn't say it again. I could say it time and time again, but please invest in this work because it's critical that it continues, and we continue to elevate the leadership of those that are impacted.
Thank you, Diamond. Yeah, just really incredible, powerful words. And thank you for lifting up, that for you, using public dollars to build capacity for investing in survivor-led leadership. I think that just really says it all and what's needed and how we can be creative and pivoting and meeting this moment with the resources we do have to continue to build the good, right? So as I previously shared, everything you've heard today, from survivor stories to policy progress, has been built through donated time, talent, and lived experience. And to truly sustain and scale this movement, we now need values-aligned philanthropic partners to help us build the backbone of this work through coordination, communications, community engagement, and honoring the storytellers who make change possible. So we'll share more details after the call, but more than anything, we really want to co-design this next chapter with you. This conversation is an offering. We'd love for CPWA's tools, stories, and strategies to be of service to support your priorities and help meet this moment for families and communities in California and beyond in a way that feels most meaningful. So with our remaining time, I'd love to open it up to funders. What resonated most today? What possibilities do you see for partnership or collaboration? You'll see a few reflection questions on the screen, and I invite you to please unmute, raise a hand, or share in the chat, and would love to take a few minutes for open dialogue, since this is where your insights can really help shape what comes next. Yeah. Sarah.
Hi, everybody. I know a couple of these organizations well, Black Women for Wellness Forever. And yeah, I really loved the way you lifted each other up. I was excited to learn about Motherboard and to learn more about maternal mental health now and about PSI, which I didn't know about at all. So I've worked at Liberty Health Foundation and am a philanthropic advisor to donors and I'm on the executive committee of a giving circle. And just what I'm thinking about with this is how I do think it's really been challenging to find funders and focus funders who are in the mental health space. So it's actually my reciprocal question is, are you finding also like, is there a network of mental health funders? Because I feel like what we want to do is see more funders come together, right? Across, like they've got an interest area, and then we want to create intersectionality around their work in that space. And I don't mean intersection, I'm not taking away from intersectionality as the importance of like, compounding forms of discrimination, but sometimes we can see it as root causes, right? How do we compound some of the root causes and systems that could have this really strong outcome here? So I'm really interested if you do see mental health funders showing up so far to this work, maybe in your existing organizations. And then coming from the experience of working with intermediaries, I feel like something that you could speak to as it goes on is it's so powerful to have those initial statistics like you've shared, that I was writing all of those down. That was incredible about how great the incidence is. I'd love to understand more about how it's the leading cause of death, leading cause of maternal mortality. I'd like to understand that even, I mean, in story form, and that's like, we can't hear that from people who are gone, but like their families could tell us. So I think that would be really profound because that is a bottom line that does get funders to pay attention, I think, to anything related in this issue area. But I think if you also get to data that can show that the mental health interventions then have, what kind of differences, does it have for the health of the family, the better outcomes and things like that. I don't care about that. I care about what the moms want, and I want to see them have that. And I want families to be supported when they go through loss. I really want all of that. I don't really care what the outcomes are. I just know that's needed. But having been with funders who have dropped organizations because they don't see that data outcome, just made me think about it like, oh God, I know there are those out there that are going to want to see the counterpoint of the data, so really interested in seeing if that's coming out of any of your work so far. And I know CPWA is new, but any of the individual stakeholder organizations. So that's two questions. Mental health funders, are they showing up? And then data about like how the interventions around mental health wellness is actually like proving to be this really important solution for the greater outcomes.
Thank you so much, Sarah. Yeah, I can just, for CPWA share, we have engaged with funders for maternal mental health a little bit. So there is a network, and that was Stephanie Telecki with the California Healthcare Foundation passing this funder webinar to them. And I know Amelia Cobb is on the call, so thanks for joining. But yeah, I think Kelly, maybe with maternal mental health now, if you would like to answer the other pieces, the question. Not to put you on the spot.
I can restate.
We have there's a lot of data available regarding prevalence rates, even screening rates. And what we're actually, let me talk about that. What we're finding is that just because a person is screened, that the screening result is not necessarily accurate. And we have data to show that in a clinical setting, positive screen rates are much lower than what would be anticipated given the population that clinic serves. Whereas in home visiting setting, positive screening rates are higher. And you think maybe you don't want to see positive screening rates, but actually you do, because a lot of times these cases are going unaddressed completely. And mothers and birthing people are simply white knuckling it. There's also research to demonstrate the impact that unaddressed perinatal mood and anxiety disorders have on the infant and developing child. So I hope that answers the question. I don't want to take up so much time.
Thank you. That's great. to know. Are mental health funders showing up for you, like for this work?
Yeah, our the first funder for maternal mental health now was actually a funder interested in the early childhood development space.
Uh-huh.
I think those funders showed up first, and now, like 18 years later, there is a collective of funders interested in specifically in perinatal mental health.
I'm so glad.
So they followed. Yeah.
I feel like there's like there's a thing happening right now where like a funder network is kind of will be interested in doing like in something intersectional with another funder network and say, hey, you know, like what do we how is this work? You know, having crossroads that are like we want if we fund the same thing, both of our networks get the outcomes and the results that we're hoping for, you know, that the community is driving towards. And I think that's an interesting opportunity to find, you know, where that crossover can happen with funder networks.
Kim, you have your hand up.
I did. I was just going to add to that because there are
Thank
quite a few that are out now. So Funders for Maternal Mental Health, which was mentioned, also the Maternal Mental Health Equity Fund with organizations and foundations like Parent G, the Kellogg Foundation, quite a few others who are doing just that, really starting to see that coalescing their networks can create greater impact and change. By creating these pooled funds and resources. It's also an opportunity when you think about it, the grantees that they're also working with to be able to make those connections amongst those organizations as well. And we've seen quite a bit of that happen with our individual foundations, but also some of these funder networks where we get to learn more information about who's doing work within this space, both on a local level, but also nationally, so that we can continue to uplift the data that we're seeing from the ground level on a broader and national landscape, but also continuing to fund the work, which is more critically important now, especially from a foundation perspective, to start thinking about how those networks are working together, because the need is even greater as our reproductive rights and the funding that's attached to that is now being dismantled, that these networks are going to be much more critical. Where I see as an opportunity is not only within the perinatal mental health space or those who are doing perinatal care, but I also see an opportunity for cross-sector intersections within this space too, because as we know, this is an issue that if not addressed, it also impacts our livelihood. It is impacted within our unhoused populations, those who are experiencing economic injustices. So if we can start to also think about the cross-sector opportunities,
Oh, smart.
especially, yeah, absolutely, where mutual aid and community building is going to be so much more critically important. But a shout out to many of the champions within the foundation space who are involved in those networks who are doing this work both locally and on a national level.
Thank you, Kim.
Elise, your hand is up also.
Yes. So I'm not going to speak to the funding piece because that is not my area of expertise. But what I will speak to is just adding to the, have there been sort of outcomes? I will actually say Maternal Mental Health Now did a pilot program in LA County, sort of showing the direct correlation between sort of trained therapists embedded in a community mental health clinic. Return to Zero Hope, which is one of the CPWA coalition members, also does a lot of work around like loss and trying to run pilot programs. But when I said that piece about how everything has been segmented and there's been pilot programs, a 2-year pilot program, let's say, it's been really tricky to kind of collect that data. And actually, in California, we have AB 2193, which was our original sort of screening bill that happened in 2018, 2019. And, the Medicaid Intervention Institute for Medicaid Innovation sort of did a follow-up to that on, hey, what worked, what didn't work, what are we seeing subsequent to that screening bill pass, which mandated, that there is at least some screening. And a couple of the things that were notable was one, just a provider shortage. I think a lot of people don't know that therapists, whether master's levels or doctoral levels, are trained. But the other piece was that there was real difficulty in data collection because it just hasn't been funded. And I think that that's been, while there's segmented parts of data collection, there's segmented pieces like CMQCC and which is our state equivalent of the PRAMS sort of data collection. Again, all of these pieces have been really small and segmented, and there hasn't been an opportunity to kind of really have a whole statewide cohesive view, not just on maternal deaths by suicide, but paternal deaths by suicide. And that's people who have living children. We don't know the data for people who experience loss and are no longer categorized in the system as mothers.
Yeah.
Thank you. I see a question for Amelia in the chat. Can you speak to more, maybe just in our last few minutes here, why ECE funders are more open to investing first in this new ideas like this?
Sure. Hi, everyone. Amelia Cobb, Senior Program Officer at the California Healthcare Foundation. I currently lead our birth equity work. And to Cassie's note earlier, Stephanie Teleke actually currently leads our maternal mental health work. So just to give some background about myself, I have been in philanthropy for more than 20 years. And I have worked for several foundations, even was an executive director of a foundation in DC that was in the ECE space, and most of my career has been in the early care education space. So the budgets are significantly higher. And so what I mean by that is the foundation's overall endowment and amount of money they have to give out is significantly higher per year. And so what might be a small grant to them could be something as simply as $100,000. Not $1 million. And so when you have higher endowments, you are more comfortable with risk. And what I mean by that is this work is not risk from my personal view. And again, I'm giving you an answer not on behalf of CHCF, but on behalf of me being in philanthropy for so long. For the larger early care education programs and initiatives and funders, risk is $1 million, 2 million, 5 million, 6 million. But a small grant is not necessarily a risk. They really see it as, hey, let me see if there's something here. And so I don't know, for example, Kelly made a comment about the first investment. I don't know what the dollar amount of that was, but I would imagine maybe Kelly, it wasn't like $2 million, was it? Right. So I think that's an example of funders are interested in this topic. And then if I could transition to now what I would say on behalf of the work I do at CHCF, in the funding spaces that I am in, and I'm in a lot of them nationally, with ECE funders and with birth equity funders and just maternal and child health funders, because some of them classify themselves differently. I would say that I am often surprised why more money doesn't flow in the spaces that maybe I even think it should. And a lot of times when I ask my fellow colleagues across the country or even in the state, um, why, what made you not fund this or fund that? And what constantly comes up is I have no idea who's doing what and who's working together. And I know we're at time, but if I just take this slide, and I want to be clear, this is not a critique, but if you all took this deck and took it and pitched it out to funders and developed an idea, the first thing they would look at is all the logos at the bottom and say, we don't know who's doing what. Because funders don't have a lot of time, and the way their work is structured, not because they're not interested, but the way their work is structured, they don't always have, we don't include myself in that. We don't always have the most accurate information to know who to fund and who's the executor. And I do think sometimes something as small as that sometimes gets in the way of collaboratives like this that are absolutely amazing and absolutely should be funded. So that's the one piece when you say like what's resonating with you, what possibilities do you see for partnerships? I think um, funders don't have a lot of great answers on the spot because the way we do our work, we have to think about it. But I think as you all move forward and grow, I mean, I've been tracking this work a little bit for the last year as it's grown and your activities. I think it would be helpful for you guys to kind of sparse out who is doing what and who are the members. So I know that's a lot, but I did just want to share that as a thought point and a feedback point to try to get more funding and more funders involved.
Thank you so much, Amelia. Really appreciate your candid thoughts. And I know we're at time. So just want to note, we opened up a poll. So would love to get folks' feedback on what resonated most with all of you and how we can keep this conversation going. And just really want to thank all of you. Today's conversation really reflects what makes this movement so special. Survivors, providers, advocates, and funders coming together to shape something bigger than any one organization. I think Amelia will certainly take your wisdom into account as we continue to really clarify these relationships and communicate that to funders as we move forward together. So after the call, we'll share a short follow-up email with slides and the recording and our concept paper and the early release storybook, along with ways to stay connected and hopefully schedule one-on-ones. In the meantime, invite folks to check out our website and get involved there too. And I'll pass it over to Somo to close us out.
Thanks, Cassie, and mostly thanks to all of our speakers, partners, and every one of you who joined us today. As you've heard many times, this work is possible because of the collaboration, and we're so grateful for everyone being a part of this and giving their time, attention, and care. As Cassie mentioned, you can expect a follow-up email from us soon with the recording from today, the slides, the materials, as well as an invitation to connect further. We'd love to continue the conversation. Really appreciate Amelia and Sarah, what you shared and the questions that are on your mind today, but would love to explore additional partnerships and simply just stay in touch as we build our movement. So thank you all for being here with us today. Take good care, and we hope to connect again soon.